All right, so next we have the systemic arteries, and we can find that on the circulatory board, which again is G30. You can look up that specific key for circulatory board G30 from 3B Scientific. And so we're going to begin with the abdominal aorta. Okay, so think about an aorta as being a very large artery. So we've obviously talked about the main aorta that comes out of the heart, but the abdominal aorta obviously is going to be actually in the abdomen. So you can see number 68 right here. Okay, that's the abdominal aorta. And then we're going to actually jump up towards the neck and look at the common and external carotid artery. So if you remember, we talked about the carotid artery coming out of the heart. So we actually have number 18 right here. And that is the common carotid artery, and then it branches off. And then here where it says 18A, that's the external carotid artery heading up towards the head. So 18 is the common, and 18A is the external carotid artery. Then we have the facial artery, that's number 7. So anywhere you see a number that corresponds with both red and blue for systemic circulation on this board, it's going to be because they have the same name for the artery in red and the vein in blue. So number 7, you don't have to know both the facial artery and facial vein, but this is the facial artery, that is the facial vein. For number 12, we have the vertebral artery. And you can see it right here, number 12. Then we have the thyrocervical artery, number 13, and the costocervical trunk, number 14. And you can see it's a trunk because it becomes several other smaller arteries. And then as we're moving near the clavicle, we have the subclavian artery. And this is labeled as the area of both 16 here along with 26. Okay, so this whole area here is the subclavian artery. We have the auxiliary artery, that's number 21. And you can see it right here. Okay, number 21, again, that's the auxiliary artery. We have the brachial artery. Remember, brachial or brachia means arm. So we can keep moving down to the brachial artery, number 24. Then we have the radial artery, number 32. And of course, the radial artery is going to be near the radius. So you can see it right there, the radial artery, number 32. We have the ulnar artery, number 29. Okay, on the ulnar side of the arm. We have the palmar arch, which is 35. As you can imagine, that's actually this loop that looks like an archway here going through the palm of the hand, number 35. We have the hepatic artery, number 61. So hepatic means liver. So we're going back towards the center near the abdomen. So number 61 right here, hepatic artery. Number 67 is the gastric artery. So that means it's going to lead into the stomach. All right, number 66 is the splenic artery. So that's going to lead into the spleen. So you can see that right here, the splenic artery. Number 64 is the renal arteries. Okay, renal means kidney. So on both sides here, it's actually labeled, you can see it on both sides, labeled right here, number 64, the renal arteries, or renal artery. We have the inferior mesenteric artery, so to that whole mesenteric area, number 69 right here. Inferior mesenteric artery, so it's on the inferior side. Then we have the common iliac artery. We're moving into the iliac artery, so that's going to be near the ilium. Okay, so we'll talk about this with the veins as well. Number 72, common iliac artery. Number 73, right here as you're going more inferior, we have the external iliac artery. And then going a little deeper here, we have the internal iliac artery. So external, internal, and then the common. Then we have the femoral artery, which is number 78. So that's going to be along the femur right here. And so you can see it's labeled number 78. And the popliteal artery, as we keep moving down, that's going to be near the knee right there, number 80, popliteal artery. And then the posterior tibial artery is going to be on the posterior side of the tibia. Okay, it's going down here. And that's labeled as number 81.